From the ultra-cold freezers at Pfizer's Michigan factory, the first US COVID-19 vaccines are transferred to waiting trucks to begin their rollout across the country. It's a shot in the arm to fight the pandemic that's killed around 300,000 people in the United States. The vaccine, developed by Pfizer and the German company BioNTech, began shipping on Sunday after receiving emergency approval by US drug regulators.
This vaccine met the FDA's rigorous standards for quality, safety, and efficacy. Science and data guided the FDA's decision. We worked quickly based on the urgency of this pandemic, not because of any other external pressure. This decision was based on the strongest scientific integrity, and I am so proud of the work that our career scientists have done.
The vaccine is packed at Pfizer's plant in Michigan and is then shipped by road and air to UPS and FedEx distribution hubs. It's then dispersed to 636 locations across the country. The first packages are to arrive on Monday. Pfizer is using containers with dry ice and GPS-enabled sensors to ensure temperatures remain below -70 degrees Celsius.
So we're shipping 2.9 million doses of vaccine. So whenever they get them in arms, that's 2.9 million people getting vaccinated. We'll be getting more and more Pfizer product, and we've got a 12.5 million of Moderna product, assuming that we get approval at the end of this week on Moderna that will ship out very soon thereafter. So 20 million vaccinations this month, and then we think we'll be up to 50 million total vaccinations of people by the end of January, and 100 million shots in arms by the end of February, just with the Moderna and Pfizer vaccine.
The FDA's special authorization paves the way for the vaccination of the nation's 21 million healthcare workers and the 3 million elderly Americans in nursing homes. But the emergency use order falls short of full approval. Pfizer has to file a separate application for the vaccine to be fully licensed by the Food and Drug Administration. For weeks now, hospitals have been carrying out dress rehearsals for the vaccination campaign. They're ready to finally start inoculations, marking what so many people hope could be the beginning of the end of the pandemic. Gavin Blackburn, TRT World.
Well, for more, let's go to Daria Unutmaz. He's a human immunologist at the Jackson Laboratory, and he joins us from Farmington in Connecticut. Welcome to the program, Daria. Now, this is a big moment for the US. As we know, the country is currently the world's coronavirus hotspot and has been for a while now. Can you tell us, when will these vaccines begin to bring down the infection rate and the death rate across the country?
Yes, indeed. Today is a very exciting and very historic moment because this vaccine was developed in a record time and it's extremely effective at 95% protection. And as you pointed out, there's going to be 2.9 million doses available this week and many, many more millions available in the next few weeks, and hopefully about 100 million by March. So we won't see the effects of this immediately because you have to realize that first of all, the immunity to vaccine takes several weeks to develop. And actually, the more protective effects are realized after the second dose because people are going to be second time vaccinated 21 days apart, 3 weeks apart. And then you have to vaccinate many, many millions of people. But my prediction is that, around March and April, we're going to see a very, very significant effect. The first effect actually is going to be a dramatic drop in hospitalization and deaths. And that's the most important right now. We won't reach a sort of a herd immunity. That's going to take more time, probably sometime midsummer. But we will see a huge effect of these vaccines in the next couple of months.
Now, this is being described as the most urgent mass immunisation campaign since polio shots were rolled out in the 1950s. We know the US doesn't have a streamlined national health service like the UK does. What challenges will officials face in really distributing this vaccine across the vast country and population?
Yes, as you pointed out, this is a massive operation and historic in that sense as well, not only because the first vaccines like the BioNTech vaccine requires a transport in dry ice in -70 degrees. So it's a huge logistical kind of a nightmare in some ways. And again, it's unfortunate that U.S. was not prepared for this kind of a healthcare issue as many countries in Europe. So that brings up an additional challenge. But I feel strongly that many U.S. organizations are very much ready, and this will go successful with some hiccups along the way, I'm sure. But the vaccine will be provided free of charge to every American eventually. I'm feeling very optimistic about this.
So in terms of the rollout, I'm wondering, what's the organisation like? Is it being spearheaded by the federal government, or is it up to the states to roll out the vaccines to their populations?
It's pretty much up to the states. Every state decides who to vaccinate first. Of course, CDC issues a recommendation, and their recommendation was the healthcare workers who are seeing COVID patients and elderly and those who are taking care of elderly and so on. But every state decides which populations to be vaccinated in which regions. For example, New York, Governor Cuomo there pointed out that this is going to be the first priority is going to be areas that are most affected by COVID, and certain areas not going to get preferential treatment. And it will be decided state by state, especially initially when the vaccines are in such a short supply.
Okay, Dario Unutmaz, we'll have to leave it there, but thank you again for joining us on the program.
Pleasure.